There are two main treatments for HLHS. The first is a heart transplant, which is just a heart transplant, but it is much harder to get because in infants and younger children, there are less donors who would donate their heart to other children, because obviously children can't donate at that young age. It's your parents' decision, and there's just not donors like that for younger children. Unlike when you're much older, then heart transplants are much easier to get as there's more donors and just more people at that age who would donate their body parts. Not donate their body parts, will die. The second procedure is a much more common procedure, which is the Norwood-Glenn-Fontan procedure, which is a set of 3 surgeries that are used to redirect blood flow to be able to travel through the whole body. As you can see, that's a normal heart on the left, and then that's the hypoplastic left heart syndrome heart. It would be similar for hypoplastic left heart syndrome, just slightly different procedures, as it would need to redirect a different direction, the opposite direction, but they're essentially very similar. So these are the procedures down here. My head's covering it, but it shows what the 3 procedures do, and I'll go into depth between the 3 procedures really quick. The first procedure is the Norwood procedure. It improves blood circulation in a baby born with hypoplastic left heart syndrome. This is the first surgery a baby would get, and it would be the starting surgery. Then next would be Glenn, but this one would essentially just be an operation that lets the right ventricle take over the underdeveloped left ventricle and allow the right ventricle to pump blood to help the left ventricle out. I can't get a picture up for the Glenn procedure, but essentially it just provides further relief on the left side of the heart, on the left ventricle. And so it comes after the Norwood procedure. The Norwood procedure you give within the first few weeks of an HLHS baby being born, and the Glenn procedure comes a couple months later. It comes at like a roughly 4 to 8 months later after the baby's born, and it simply just adds further relief for the heart. And then the Fontan procedure comes between ages 2 and 5 years of age. So as it said, that's the third and final surgery for hypoplastic left heart syndrome, if you get this procedure, which is most commonly the procedure given, as heart transplants are much harder to get at a younger age, as I said previously. Essentially, this just improves blood flow from the lower body to the lungs, which further decreases the workload of the single ventricle and improves oxygen levels. So, because of this, exercise is very important for children with the Fontan procedure, as I stated in my previous video. So it's very important for children to exercise, so their heart works out more, pumps blood, and it just essentially allows their body to stay healthy with this procedure and keep the body strong as of the way the blood flows throughout the body.